Hi, I'm Bob Nations. I'm the owner of Senior Helpers in Napa, California, and this video is a training video for caregivers on COVID-19. All caregivers really should be aware of what COVID-19 is, how it gets transmitted, and the circumstances for why they should not go to work. Criteria to return to work after exposure to COVID or infection will all be covered in this presentation. Senior Helpers provides all PPE necessary and other resources such as masks, gowns, gloves, thermometers, cleaning supplies, whatever you need in order to be safe and protect the people you love. What is COVID? It's an infectious disease. It's easily transmittable. High rates of serious illness and death, especially at-risk groups. Elderly and people with heart disease, diabetes, chronic respiratory disease, and other chronic conditions are highly vulnerable. What are the symptoms? The symptoms range from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. Symptoms often are similar to other viruses such as fever and chills, fatigue, cough, muscle or body aches, sore throat, headache. Other symptoms reported with COVID infection include loss of taste and smell, congestion or runny nose, similar to a common cold, shortness of breath, difficult breathing, nausea, vomiting, and or diarrhea. How do you prevent COVID-19 from spreading? Number one is it remains 6 feet from anybody. Cover your cough or sneeze with a tissue or your elbow. Throw your tissue in the trash and wash your hands. When in public, you should always wear your mask over your nose and your mouth. Do not touch your eyes, nose, or mouth. Clean and disinfect frequently touched objects and surfaces. Stay home when you're sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds. Wear your mask correctly. Wash hands and use hand sanitizer before putting on your mask. Put mask over the nose and the mouth and secure it underneath your chin. Fit the mask snugly against the sides of your face, slipping the loops over your ears and tying the strings behind your head. If you have to continually adjust your mask or it doesn't fit properly, try a different mask. Make sure you can breathe easily. CDC recommends washing hands with soap and water whenever possible because it reduces the amount of types of germs and chemicals on your hands. If soap and water are not readily available, using hand sanitizer with at least 60% alcohol can also reduce germs and prevent spreading to others. Choose hand sanitizer that contains at least 60% alcohol. Avoid alcohol-based hand sanitizers that are not approved by the FDA. Properly apply alcohol-based sanitizer by rubbing the gel over a surface of your hands and fingers until your hands are dry. Swallowing alcohol-based hand sanitizer can cause alcohol poisoning. Keep them out of reach of your children and supervise their use. Use gloves when cleaning and disinfecting or providing care to someone who's sick. When routinely cleaning and disinfecting, follow these precautions listed on the disinfectant product label, which may include wearing gloves, having good ventilation by turning on a fan or opening a window, and wash your hands after you remove your gloves. When caring for someone who's sick, use disposable gloves when cleaning and disinfecting the areas around the person who is sick or other surfaces that may be frequently touched in the home. Use disposable gloves if touching or having contact with blood, stool, blood fluids such as saliva, mucus, vomit, or urine. After using disposable gloves, throw out in a lined trash can. Do not disinfect or reuse the gloves. Wash your hands after you've removed the gloves. How to stop the spread of COVID-19 if you've become infected? The number one rule is stay home. Most people with COVID have mild illness and can recover from home without medical care. Do not leave your home except to get medical care. Do not visit public areas. Take care of yourself. Get rest and stay hydrated. Take over-the-counter medications such as Tylenol or Advil to help you feel better. Stay in touch with your doctor. Call before you get medical care. Be sure to get care if you have trouble breathing or have any emergency warnings or if you think it's an emergency. Avoid public transportation, ride sharing, and taxis. Separate yourself from other people. As much as possible, stay in specific rooms away from other people and pets. If possible, use a separate bathroom. If you must be around other people or animals, wear your mask. Tell close contacts that you may have been exposed to COVID-19. An infected person can cause the spread of COVID-19 starting 48 hours or 2 days before the person has any symptoms or tests positive. By letting your close contacts know that you've been exposed to COVID-19, you're helping to protect them. Additional guidance from the CDC website is available. If you're diagnosed with COVID-19, someone from the health department may call you. Answer the call to slow the spread. What are the reasons for not coming to work? Number one, you don't feel well, or you have a family member that isn't feeling well. If you've tested positive or have any of the symptoms, you've been in close contact with a person or an infectious material associated with a person testing positive. If advised by a public health official or an authority to quarantine or isolate. If you've traveled internationally or in an area of increased restrictions due to increased outbreak. Caregiver certification. We will be contacting you to ask you to sign a certificate that understands that the circumstances where they must not come to work. Caregivers should take their own temperature and the client's temperature. Senior helpers will supply non-contact thermometers to all caregivers. When can you return to work after being exposed or to have COVID-19? First of all, no symptoms and being tested negatively for COVID-19. If you're symptomatic, after symptoms have been resolved or at least 10 days since the onset of symptoms or at least 24 hours without a fever. If you've tested positive, at least 10 days since a specimen collected and you have no symptoms. If exposed to a positive case, at least 14 days since the exposure plus tested negative and no symptoms. If you're ordered to quarantine or isolate, 10 or 14 days since the order, depending on the type of order. Call your senior helper office if you don't feel well, if a family member doesn't feel well, if you want to report any violations, if you feel you haven't been treated fairly or you're not being heard. You may be entitled to supplemental pay, sick pay, or workers' compensation. Call to find out about these benefits. Our offices are conveniently located in Napa, California, with a phone number of 707-251-1540, or Santa Rosa with a phone number of 707-525-1540.